Imagine feeling like a dark cloud has found you everywhere, draining your energy and joy. This is not just a bad day. It could be the sign of clinical depression. Welcome to RxHealthyHabits Mental Wellness Series. Joe here coming at you. And today in our episode, I want to do a checkup from the neck up. We'll explore how to recognize when it's time to seek professional help for this common mental disorder. We're going to use the DSM-5, which is the Diagnostic and Statistical Manual of Mental Illness, to really go through and know when you should act and touch on effective treatments. Otherwise, you're really not going to be able to take charge of your mental health. So what is a checkup from the neck up? Well, a checkup from the neck up is a simple self-assessment of your mental, emotional well-being, much like a physical exam for your body. It's about tuning into your thoughts, feelings, and behaviors to spot any early warning signs of issues like clinical depression. Now, this is not a diagnosis. We're not trying to diagnose your condition. It's just a starting point to get you to decide if professional support is needed, because mental health is just as important as physical health. And I'm going to have my avatar, Abby, who's a physician, is going to go through and talk about some of the signs and symptoms outlined in the DSM-5 that you might want to be taking note of and see if you need to seek professional help. I'm going to come back and wrap it up. Here is Abby.
Hello, Abby here. Clinical depression or major depressive disorder. Here are some signs or symptoms commonly associated with this condition. Depressed mood most of the day, feeling sad, empty, or hopeless, often noticed by yourself or others. Markedly diminished interest or pleasure in almost all activities, even ones you once enjoyed. Significant weight loss or gain or changes in appetite without dieting. Insomnia or hypersomnia, trouble sleeping or sleeping too much. Psychomotor agitation, leading to restlessness or retardation, feeling slowed down. Fatigue or loss of energy even after minimal activity, feelings of worthlessness or excessive or inappropriate guilt. Diminished ability to think, concentrate, or make decisions, and becoming indecisive. Recurrent thinking of death, suicidal ideation, or suicide attempts. These symptoms must cause significant distress or impairment in daily life and not be due to substances or medical conditions. If you have 5 or more of these symptoms every day, check with your healthcare provider. Depressed mood or loss of interest must be one of the 5. I think I highlighted the list from DSM. Back to you, Joe, to wrap it up.
Thanks, Abby. You did a fantastic job as usual. I want to go through now and discern when it's time to seek professional help. And I think she mentioned if you checked off 5 or more of these DSM symptoms for 2 weeks or longer, and if they're interfering with work, relationships, or self-care, it's time to reach out. You don't want to wait. Here's some other red flags. Thoughts of self-harm, inability to function normally, or if symptoms persist despite making lifestyle changes like exercise or better sleep. Seeking early help makes a huge difference, and professionals like therapists and doctors can provide tools to help you to recover. Different therapies out there, when the psychological therapies and medication therapies are put together, they're highly effective. Psychological therapies are cognitive behavioral therapy, or CBT, helps reframe your negative thoughts. Interpersonal therapy, IPT, focuses on relationships and social roles. And supportive therapy provides emotional guidance and coping. As a pharmacist, of course, I'm always willing to talk about the antidepressants that really have had a big help in this area. Antidepressants like SSRIs, they help balance brain chemicals, and then we have the SNRIs. People don't respond to SSRIs. This is another good tool under the doctor's supervision. Here's a call to action I want to give you. If you have some of these symptoms that are getting worse or they're not going away, you really need to think about reaching out to some healthcare professionals and get on the track to get this addressed, because it could be a really serious and dangerous thing. So with that, as always, come to Rx Healthy Habits for more great tips, more great information, and we hope if this is something that you're struggling with, that you take action. So God bless you, and may God keep you. Joe signing out.